This is Dr. James Chappell. Since 1971, I've been a health researcher and educator specializing in chronic, severe, and so-called terminal illness. I'm a board-certified chiropractic physician, traditional naturopath, clinical nutritionist, and medical herbalist. I know what helps the body heal itself, and more importantly, what doesn't. Today, I want to talk about the myths that are preventing Americans from achieving optimum health and longevity and some of the solutions available. We have 5 nutrition myths that are preventing Americans from achieving optimum health and some of the solutions available. Bone health. Osteoporosis is a major public health threat for nearly 44 million Americans. Often people don't know they have osteoporosis until a bone breaks. This disease can lead to pain, hospitalizations, surgery, disability, and even death. Of the Americans who have osteoporosis, 80% are women. Heart disease. 1 in 4 women in the United States will die of heart disease. 80% of women ages 40 to 60 have 1 or more risk factors for heart disease. This doubles their chances of developing this deadly disease. Obesity. Nearly 2/3, that's 66% of adults in the U.S. are either overweight or obese. Women face a particular disadvantage in overcoming this threat because they have more body fat and less lean muscle tissue. This increases their risk of a multitude of conditions: coronary heart disease, stroke, metabolic syndrome, sleep apnea, osteoarthritis, gallbladder disease, fatty liver disease, certain types of cancer, and type 2 diabetes. Diabetes. Every minute, 6 people in the world die of diabetes. Of the 25.8 million Americans with diabetes, the majority are women. The disease affects both men and women, but runs a more severe course in women. Cancer. Think of 10 women in your life, mothers, daughters, friends. 4 of them will likely get cancer. 2 or more will die from it. Our health is impacted by lack of pH balance. When body tissues and blood pH are out of balance, metabolic acidosis occurs. If individuals do not get proper nutrition, it creates an acidic environment that's low pH. This causes minerals to be taken out of bones and protein out of muscles. Long-term excess acidity leads to thinner bones, lower muscle mass, and poor heart health. We are especially deficient in calcium and magnesium. 40% of Americans do not get enough calcium, and it's not because they don't drink milk. 68% do not get the recommended daily allowance of magnesium, and 20% don't even get half the recommended daily amount. If Americans are considered overfed, how can we still be missing so many vital nutrients? Our farming methods are to blame. An Earth Summit report indicated that the mineral content of North American farm soil has decreased by 85% in the last century. Mineral depletion in our soil causes demineralization in our food and in us. We may think pesticides are to blame, but the obvious answer may still not be enough. Pesticides are not the only thing to consider. Organic food may contain different and fewer pesticide residues than conventional grown foods, but not zero. Fortunately, numerous studies over the last 50 years have shown that organic foods have more vitamins and minerals than conventionally grown foods. But organic foods cannot supplement all nutrition losses. Many foods aren't what they used to be. Today, a person would have to eat twice as many tomatoes to get the same amount of calcium as they would in 1948. And they would have to eat 60 servings of spinach to get the recommended daily amount of iron. Many of you don't know what's really in your vitamins. Most vitamin supplements are synthetic and contain inorganic elements, binders, and fillers. These substances cannot be broken down by the body, so they pass through right along with other waste products. In fact, only 10 to 20% of the nutrients in solid vitamins are actually absorbed by the body. What will a lack of vitamins and minerals do? Vitamins and minerals must be whole food complexes and taken together to fulfill the role. They need each other to work. Trace minerals serve as catalysts to vitamins within the cells. Calcium, phosphorus, potassium, magnesium, sodium, chloride, each of these elements have a daily requirement in excess of 100 milligrams that often goes unmet. The current available supplements are numerous. There are nearly 9,000 different food and health supplement retailers in the United States. Now that's over 300 retailers for every essential vitamin, major mineral, and antioxidant. With so many options, trust can be an issue. Even common supplements can be misleading. As an example, not all calcium preparations are absorbed equally. Large mesh calcium carbonate is often manufactured in a compact form that does not readily dissolve or is absorbed, thus providing little benefit. Even so, complete multiple vitamins rarely have the daily value for necessary minerals such as calcium, magnesium, or potassium. Exercise and basic nutrition are not enough. Even the healthiest people have 20% risk of heart disease, 30% risk of stroke, and 50% risk of cancer. The goal should be to lower the risk of disease as much as possible through consuming whole food nutritional supplements. The body initially uses calcium to fix pH imbalances. When the intake of alkaline foods is not enough to neutralize acidity, the body first uses whatever calcium is available to maintain pH balance. This is because calcium is a major buffering and alkalizing mineral. The first calcium source the body utilizes is usually calcium from your bones and teeth. In fact, the strongest evidence in support of maintaining an acid-alkaline balance relates to osteoporosis. A healthy lifestyle is one key. Exercise is important as well as eating as healthy as you can, but we must also screen what goes into our bodies. Organic food has fewer pesticides and other toxic chemicals. Learn to read the labels. Reading the label of supplements will help you to understand what's in them, including if they have harmful excipients. Avoid food products that contain ingredients that a third grader cannot pronounce. If you don't understand something on a supplement label, don't be afraid to investigate and ask questions of the manufacturer. Humans need vitamins and minerals. The following minerals are not always found in their natural form in most vitamins and supplements, and remember, synthetic minerals are harder to absorb. We need magnesium, iron, chromium, sodium, sulfur, chloride. We must neutralize acidity in the body. Most of us eat plenty of acidic foods without even trying. The recommended proportion of alkaline food to acid-forming food is 80% alkaline and 20% acetic. However, it can be challenging and frustrating for even the most health-conscious person to reach that recommended proportion. How can you get the most out of calcium supplements? In order to be absorbed properly by the body, calcium supplements must contain the necessary trace and other minerals, which are all dependent on each other. See the mineral wheel. Only if calcium is properly absorbed can it contribute to alkalinity and provide the desired health benefits. Also, a Stanford study has shown that calcium taken with vitamin D3 can decrease melanoma cancer by 57%. Coral minerals with calcium has a real advantage. Coral minerals with calcium contain a wide range of optimal mix of major and trace minerals which match the body's ratio perfectly. In fact, when compared with other supplemental sources of calcium, coral calcium had the highest absorption rate at nearly 70%. Even blood tests taken 4 hours after consumption showed that coral calcium had twice the absorption rate of other calcium sources. Coral minerals with calcium are also more successful in balancing pH, which makes the body and joints more healthy. Avoid excipients where possible. Many supplements contain 25 to 50% binders, fillers, and other excipients. Excipients are inactive and sometimes harmful substances that are used to help in the manufacturing process, similar to extra preservatives and chemicals added to our food. The right provider will ensure that their coral mineral supplement is excipient-free. The excipient test. You can tell whether a mineral supplement contains excipients by performing a simple float test. If a mineral supplement floats, it contains excipients. If the mineral supplement sinks or disperses, it should be all natural. Remember, a quality coral mineral calcium provider has an above-sea fossilized and eco-safe source. Coral LLC is that source. Introducing Coral LLC, global leaders in natural minerals. pH and coral mineral complex. We recognize the all-too-common health problems that people face, which stems from excess acidity in the body. In response, we developed a coral mineral calcium supplement with greater absorption that can maintain proper pH and allow people to feel better and even live longer. What sets us apart? Our supplements have trace minerals that allow for greater calcium absorption. We manufacture naturally. We're excipient-free. Our products are pure and diffuse in water, so you get the full benefit of your health investment. We are eco-friendly and organically certified. Take action today. We want you to experience the health benefits that can come from coral mineral supplements, specifically Coral Complex 3. For your participation today, we offer you a free sample. Let us help you. Call today 800-882-9577 or visit coralcalcium.com.